what this exercise does is it recruits the inferior fibers of the glutes, or the glute max, which helps push the right pelvis around so it's more neutral as well. So how I do this, I'm contracting my left midriff here, my left oblique, and I'm doing that by pushing my hips down into the ground. So I do that first. It's just a small contraction, maybe about a 3 out of 10 effort. You can think about like if you're trying to crunch up this way, doing crunches this way, it'll activate this oblique. You're kind of doing it reverse, so you're doing a crunch against the ground to get this one activating. So we want that first, so that's important to get. So with that activating the whole time, then from here I push the knee forward as far as what I can, still keeping that contraction here. And then from here I lift my knee off my other leg, just as high as I comfortably can, without losing contact of the tripod on my foot. So the tripod is the center of the heel, knuckle of the big toe, knuckle of the little toe, but I particularly want to keep contact here and the inside edge of the heel here. So I want that. So I just go as forward as I can, up as high as I can. And for a lot of people, it's not very much range at all, which is totally fine. And I feel that engaging right under here. I'm not pushing into the wall. So it's just more of a sense of pushing forward, lifting the leg here now. Then I'm just doing my breathing. So I'm breathing just nice and easy in through the nose, out through the mouth. Just letting the air comfortably come out, and then a little bit of so like fogging up a mirror, that kind of sound. And I hold that for 2 to 3 seconds. Then I let the air smoothly and softly come in. Let the air come out, and then so that I'll engage some of the side abs when I do that little bit of a forced exhale here. So breathing as easy as possible. I really can feel this firing well here. So I'm holding this for 5 to 10 breath cycles. And what I'm aiming at not to do at all is that my knee comes backwards. Don't want the knee to come back at all. It needs to stay pushed forward, especially if you lose sense of this muscle activating here. Push the knee forward. To gain more of a strengthening effect with this exercise, we're using a mini band or a tight off TheraBand around the knees. So everything is exactly the same as what we just talked through. Though I'm pushing forward, then I'm lifting up, and I'll feel that resistance a lot more here. So it's not a heavy band. And what I'm particularly paying attention to when there's a band that comes into it, the body can have a tendency of losing all the connections that we should have. So it'll lose this engagement here. The body will want to arch. So as I push forward and lift, the body wants to go into this arching motion with the lower back that will not get the right muscles and just put you back into the extension pattern that's already in. Okay, so we want to make sure there's no change in everything that we've got going on. We're just adding that little bit more resistance.